A Pap smear is a screening test used to detect potential precancerous or cancerous cells of the cervix. The cells are examined under a microscope for any abnormalities. Currently, a Pap smear should be done starting at the age of 21, regardless of the onset of sexual activity. A Pap smear should then be continued every other year from the age of 21 to 29. This is provided the woman does not have a history of an abnormal Pap smear. Women ages 30 to 65 only need a Pap smear every 3 years and only every 5 years if the Pap smear is tested and negative for both cytology and high-risk HPV or the human papillomavirus. Again, this is provided the woman does not have a history of an abnormal Pap smear. Women 66 and older can stop having Pap smears if they have had an adequate previous screening and are not otherwise at high risk for cervical cancer. Women who have had a hysterectomy, including the removal of the cervix, and who do not have a history of abnormal Pap smears do not need to proceed with Pap smears. An abnormal Pap smear can be reported in several different ways. Atypical squamous cells of undetermined significance, atypical glandular cells of undetermined significance, low-grade squamous intraepithelial lesion, high-grade squamous intraepithelial lesion, or adenocarcinoma in situ. An abnormal Pap smear can be caused by benign issues such as recent intercourse, use of different hygiene products, or smoking. A common cause of an abnormal Pap smear can also be HPV or the human papillomavirus. The follow-up from an abnormal Pap smear due to HPV is sometimes just expectant management, meaning a 1-year follow-up Pap smear, as some women clear the virus on their own, or you may need a minor procedure called a colposcopy. The human papillomavirus is a sexually transmitted infection. More than 30 to 40 different types of HPV are typically transmitted through sexual contact infecting the genital region. 80% of women come in contact with some type of HPV at some point in their life. Some types of HPV cause genital warts, whereas some may cause an abnormal Pap smear that may progress to precancerous lesions and invasive cancer. The human papillomavirus is a cause of nearly all cases of cervical cancer. Some women may be able to clear themselves of the virus by staying healthy, taking a multivitamin with folic acid, or not smoking.